This patient was referred to me for endodontic retreatment of tooth number 9. Her teeth are in pretty bad shape, and they've done some really bad root canals and restorations on her, unfortunately. And she's a young lady anyways. As you can see, periapical relucency associated with tooth number 9 here. So today we went ahead and started and completed the endodontic retreatment in one appointment. And let me show you. These are the fragments of gutta-percha that I pulled out of the root. And as you can see, look at the color of them. They're not supposed to be this color. That means when the dentist did this root canal, he or she did not adhere to the fundamentals of endodontics, rubber dam, isolation, and irrigation with sodium hypochlorite activation. There was, as you can see, color change means micro leakage and bacterial growth. And here's the post-op. So went ahead and removed the gutta-percha that I showed you. I was able to just pull them out with my Endo Explorer and edge files. There were a bunch of them in there. And instrumented to size 60. The apical diameter was 60, so placed an MTA plug. The dentist had requested a post space, so I left post space for the general dentist and went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. So I'm optimistic that this will heal, but if it doesn't and this tooth later on needs an apical, the apical is very easy because I used MTA, and this is white MTA, by the way. It doesn't discolor. But I used MTA here, so my apical will be much easier. That's why I always say to think ahead, think about the next step, next procedure, and this is what we did here. Instead of filling with obturating with gutta-percha, I obturated with MTA, so later if this tooth will need apical, the apical will be much easier, much faster. All right.